This lecture is on professional behavior. The root word in the word professional means hold dear to a set of beliefs. This lecture is about professional behavior in the workplace. It is through actions that professionalism is demonstrated. Your success as an occupational therapy practitioner will be determined to a large extent by the level of professionalism you practice on a daily basis. In the medical world, there has been a paradigm shift in the practice environment. The old paradigm is institutional and a medical model, disease disability perspective, individual and facility providers, quality assurance, and independent professional practice. The new paradigm is community-based and consumer-focused, wellness and prevention, team regional group providers, quality improvement, and interdependent directed and managed services. Dependability is a skill that every professional has to have. Being on time and responsible in carrying out duties and responding to a client-patient needs. If you are late, call in and let somebody know. If you're going to be late for a patient session, inform them and the other team members so adjustments can be made for the patient to receive everything they are to receive as far as their treatment sessions go. It's all about the patient. As a team member, you must meet deadlines and adhere to schedules. If these are not met, you not only throw off the other members of the team, but your patients as well. Your patients will lose trust in you, and so will your colleagues. How you present yourself is key to the professional behavior. Your demeanor, from your facial expression to your mood, determine how your colleagues and patients will think of you professionally. If you've had a bad day, you will need to leave it at the door, and sometimes wearing a happy face on a stick is what you have to put on. Your patients don't need to know you're having a bad day. They are worried about themselves. Professional presentation is how you dress. It is okay to have your own style, but you may need to calm it down a bit in the workplace. Having tattoos or wear simple jewelry is fine, but find out what your company's dress code is. You may need to cover up your tattoos at work if the workplace would find them offensive. Manner. Be polite in all situations. If there is a situation you have to handle, then use the DESC method taught to you in AH 106 to handle it. Initiative. This is a sign of a professional to initiate tasks before they are asked to do them, or try and look something up before asking where the answer is. This demonstrates that you are positive, highly motivated, and self-directed. These behaviors are increasingly required by employers. Just go and look things up before just asking somebody. But typically the rule of thumb is if it's taking you more time than needed, and it's affecting patient care, then just ask. Empathy. Showing empathy is necessary prerequisite to building therapeutic relationships. The ability to listen, understand, and share is a way to build rapport. This also shows sensitivity to other person's perceptions of the situation. Cooperation in the medical field is crucial. You do not work alone, you work as a team. Teamwork is the key to success for a patient's benefit, and if the head of the team, which is the patient, then the rest of the team will be happy. The ability to collaborate in interdisciplinary, multidisciplinary, and transdisciplinary teams shows you are cooperative, flexible, and adaptable to any situation. This also helps with working towards a solution to a situation compared to just focusing on the problem and never moving forward. Organization. Clients and others will often make value assessments of the services you are providing based on your perception of how organized you are. If you come into a room and have to go in and out several times to get supplies you forgot, the patient will lose trust in you because you are not prepared. This is also important for teamwork. Competence and clinical reasoning. As you have learned, being competent and using your clinical reasoning skills is important in the dynamic process of inquiry that takes place within clinical practice. Problem-solving skills, knowledge, and experience are needed to make decisions in practice. Sometimes the problem is very simple, and sometimes it can take the team to pull all their experiences together to come up with the best solution. Supervisory process. Once you are hired in a new position, you will be given an assessment of how you're doing on the job. Your ability to give and receive constructive and positive feedback shows signs of professionalism. Most of the time, the information that you are told is something you already know about yourself. It is important to listen, reflect, and make changes to your behavior. An example is not getting your paperwork completed in a timely manner. You should look at your day and see if there's a reason why it's not done timely. Is it that you are all over the building because your schedule is set up that way? The professional thing to do is sit down with whoever is scheduling and make a better plan. Or could you start your paperwork while you're working with a patient? Or do your paperwork right after each patient you see. If you still can't figure it out, the problem, then ask somebody for suggestions. Verbal and written communication is important in showing your professional side. You must be able to effectively articulate a patient's staffing, conferences, rounds, in-services, and other meetings, the patient's progress, what the next step is, and if you need to train the staff by doing an in-service, you should be professional in your presentation. As you know, you must be able to produce written documentation according to the particular facility standards and showing justification for services. Don't be afraid to have someone edit your documentation, because by doing so, you learn how to write more professionally. So in summary, you have learned how to present yourself professionally in the workplace, from dressing, verbal and written communication, and how to give and take constructive constructive criticism.